Thank you, Ari. Thank you, Allied and Adjuvant, for sponsoring this. I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, grandmother of 1, and I don't know if you guys know, but we now have another one on the way.
Aww.
So very exciting times at my house. Congratulations to everybody who is on this webinar, because if you're listening, it means that you're about to welcome, or at some point going to welcome, a newborn in your midst. And it really is a very exciting time. It's also a little bit scary. Even as a grandma with lots of experience, it can be scary. And I know that our families feel it, the new parents feel it. There are so many decisions that have to be made. And now it's almost harder because there is so much information. If you Google something online, you're going to get 7,000 responses, and you can't read them all, and which ones should you trust? So you've taken a great first step by finding a source that you can trust. And Allied Physicians Group is a trusted source for pediatric information. We are over 30 individual pediatric practices, physician owned, and we have lots of good information for you. You're going to learn a little bit about Allied Physicians Group later on. But finding that good source, knowing where you're getting your information, is key. So tonight we had to have a wonderful panel for you. I'm going to have them introduce themselves, and then we're going to start the presentation. So Dr. Eric Levene, you're up.
Hi, I'm Eric Levene. I'm a practicing pediatrician in Westchester County in White Plains. I've been practicing for 29 years. I'm a father of 2 who have moved on from pediatrics. And I just enjoy doing what I do. And there's nothing like holding that newborn baby in my office. And as much as you guys enjoy it, the pediatricians enjoy it probably more.
We do, and then we can give them back to you when they cry. Dr. Kasnicki.
Hi, so I'm Dr. Kasnicki. I'm a pediatrician at Peconic Pediatrics. We have an office in Riverhead, and then we have a smaller satellite office in Southold. I've been practicing for over 15 years. I have 3 kids and a dog. And we were all in the same boat as you guys. So we've been there. So we understand what you're going through. So hopefully we will give you some good guidance tonight. Looking forward to it.
Thank you. And Dr. Lidoshore-Fuld.
Hi, everyone. I'm Karen Lidoshore-Fuld. I'm a neonatologist and a pediatrician. I practiced neonatology for about 10 years before joining Pediatric Health Associates in Plainview 5 years ago. And it's been such a wonderful change and so amazing to see the babies grow up. So I'm getting to see the other side of it now. I have 2 daughters of my own, 14 and 9, and 3 dogs. So pretty busy at home.
Karen, do you want to just tell people what a neonatologist is for those who may not know?
So a neonatologist is a physician that specializes in taking care of newborn babies, mostly premature newborns. Depending on where you are, what hospital you are, there's a neonatal intensive care unit most of the time, which is where sick or premature babies would go. And that's where I practiced. And then those babies, as they grow, feed and grow, and we get them to a point where they can leave the NICU, are sent out to pediatricians. And so there needs to be communication between neonatologists and pediatricians.
Yes, so today we're really going to talk about the normal full-term baby. We don't really talk about the preterm baby, but it happens. and those babies, generally do really well and go on to your pediatrician, and your pediatrician is a great source of information for that as well. So if that does, end up happening to you, the same pediatricians who are going to help you get through the first few months, no matter what, will be there for you with this as well. So Dr. Karen, why don't you start us off?
Okay, so I'm going to be talking about feeding first. There is obviously the choice of whether to breastfeed or bottle feed or a combination of both. And while there are tremendous benefits to breastfeeding, it doesn't work for everyone. And I know in my case with both of my girls, I did a combination of both. And obviously, as your pediatrician, we're going to be supportive of whatever you decide is best for your family and for yourself. The most important thing is that as the mom, you are happy and healthy so that you can take care of your baby. So in terms of feeding, whether it's breast or bottle, there are certain cues that we look for in the baby to determine when it is feeding time. And it's important to catch the earlier cues so they don't get to a point where it's difficult to get them on the breast or to get them to calm down to feed well. So initially you're going to see some rooting where they're turning their head a little bit. They start to put their hands in their mouth. And then eventually it escalates to a point where they're crying, which is totally normal. Babies cry. And this is one of the things that they are trying to tell us. So in terms, I just want to go back to breastfeeding for 1 second. Just so you know, we do have lactation consultants in Allied. And actually at Pediatric Health Associates, we have Dr. Lena Edelstein, who is a physician, a pediatrician, and now a certified lactation consultant. So if you choose to breastfeed, if there's any concerns, questions, she's there. There are other people within Allied that also do lactation consulting. Okay, so going back to how much does a baby need to feed? In the first few days of life, a baby really does not need that much of volume. So they're born with extra weight. We expect that a baby will lose about 10% of their body weight in the first week of life, and then regain that weight, get back to birth weight at about 14 days of life. And we were built to go along with that. So the breast milk really doesn't come in until day 4, day 3, day 4. So initially it's just a little bit of colostrum, which is really all they need. And then by day 3, 4, the breast milk comes in more. So babies should be fed at least every 3 to 4 hours if they're bottle feeding. If they're breastfeeding, it could be much more frequent than that initially. So there's periods of every 2 hours, and sometimes usually at nighttime, it's going to be more cluster feeding where it could be every half an hour. And this is generally the first 2 weeks of life where they're getting used to taking the breast milk and helping it to come in. So it does get easier. It does get better with time, but it's a lot of work in the first couple of weeks. So in terms of how many ounces, if you're doing bottle feeding, we would expect a newborn to take about 15 milliliters or half an ounce initially, and then maybe to go up to 1 ounce in that first week of life. And how do you know that they're getting enough? So basically we say if a baby is draining the bottle completely, you want to put a little bit more in, half an ounce to an ounce. There should always be a little bit left in that bottle. And then in terms of the breastfeeding, we're going to be looking at, for bottle and breast, we're also going to be looking at how many pee diapers there are, how many poop diapers there are. In the first few days of life, the number of pees are equal to how many days old they are. When you get to about 5 days, that's going to go up tremendously to 6 to 10 wet diapers a day. And the poops initially are going to be this thick, tarry meconium, which when the milk starts to come in day 4-ish, you're going to see, or 3, 4, you'll see the poop transitioning to a more yellow, mustardy, seedy consistency. In terms of sleeping, so we talk about safe sleep. We talk about safe sleep and SIDS. SIDS, well, it's now very rare, still sometimes does occur. And this stands for sudden infant death syndrome, also known as crib deaths. As I said, it is very rare now. In the 90s, there was a back to sleep campaign, which has led to the most significant decline in the incidence of SIDS. So in terms of safe sleep, we want our babies, just like the baby in this picture, in a crib or a bassinet with a well-fitting sheet, no loose blankets, no pillows, no bumpers, nothing else in there with them, and on their back, as this baby is. We'll talk a little bit about swaddling later. So this baby is not swaddled, but often in the newborn period, we are swaddling babies. Quantity of sleep varies. In the first few weeks of life, babies tend to have their nights and days mixed up, because when you're walking around during the day with that baby in the womb, you're soothing them to sleep during the daytime. When you go to sleep at nighttime, they're ready to party. So that doesn't change right away. It takes a couple of weeks for that to switch over. And in some cases, we'll tell you to wake them more frequently during the daytime so that maybe you can get a little bit more sleep out of them at nighttime. But honestly, you want to make sure that the quality of the sleep is there. The quantity, it'll get there. By 3-4 months, it'll be much better. But initially, it's going to, again, be some work. So in terms of safe sleep, going back to that, the temperature is really important. So they did find that being on the warmer side is more of a risk for sudden infant death syndrome. So the range that will tell you is about 68 to 72 degrees to keep the room, but to err on the cooler side. So 68, 70. And then when you're dressing the baby, we would say to dress them with one more layer than what you're comfortable in your home. Okay. And then swaddling. So this baby is really nicely swaddled. The best swaddlers you will find will be nurses in the hospital, in the NICU. Swaddling recreates the feeling of being in the womb. So a lot of babies are much more comfortable and sleep much better when they are swaddled. It's important to make sure you're not swaddling them too tightly, especially around the hips. You want them to be able to move a little bit. I do tell people, so in this picture, it looks like the arms are down here. I do tell people to put the arms here, the hands here, midline, which it goes back to my NICU experience, because everything developmentally is midline. So you can swaddle them. They do also have sleep sacks. Halo is one of the big companies that has sleep sacks. Initially, I would do one that has the Velcro that also gives them that feeling of being nice and comfy in the womb, like when they were in the womb. And then when they get a little bit older, then they have sleep sacks that have the arms out so that they can move around a little bit more. Usually by about 3 months, they're sometimes even 2 months, they're breaking out of the swaddle. And then, it's time to switch into a sleep sack. I think that's all that I have.
Okay, so I'm going to be talking about grooming. And you could see here, these are some routine, everyday baby care topics that you will become very familiar with. I'll try to give you some pearls and some tips to make you feel more comfortable about each topic. So let's start with diapers. I think the rule of thumb with diapers is that, you can pick any type of diaper that works for your family, whether that's cotton or cloth. I think the thing to remember, just like whenever we have anything on our skin for a long time, our skin can get irritated easily. And the same goes for babies and diapers. And so you want to try to change the diaper as frequently as you can. Sometimes some babies are more sensitive than others. And so some babies can get diaper rashes or heat rashes more commonly than others. And for those babies, it might make sense to choose a sensitive type of diaper. They make those products and they're readily available. But in general, diaper rashes are common. You want to try to air dry them in between diaper changes if you do see a rash. And sometimes rashes get worse, or they get more red, or they get more dots and they spread. And for those kind of rashes, we typically like to see them in the office. Sometimes they might need a prescription ointment from us, but they're very common. They're very easily treated. And so it's something that we deal with all the time. For nails, obviously babies don't really get dirty and they don't get grimy underneath the nails. And so we're not really cleaning the nails. What we want to do is we want to just keep the tips of the nails nice and blunt and not sharp. Babies are exploring all the time, and they're using their fingers, putting them in their mouths, maybe scratching their skin. And so we don't want them to inadvertently cut themselves or scratch their cornea. And so you can cut the nails two different ways. You could use a clipper, a baby clipper, or you could use a nail file. I can tell you from experience that using a baby clipper is very difficult to do in a baby. And I have cut the fingertip of my own baby, and it's not pleasant, and it's a little bit scary. And so I always recommend files. They have baby files that are very small. They're very easy to use. You can use them just a couple times a week. And that will work really well to keep the tips of the fingertips nice and blunt. So ears. There's not a whole lot you need to do with ears. I mean, wax is a good thing. It's Mother Nature's way of protecting our eardrums. As a baby, the wax is very thin. It should fall out on its own. You could use baby cotton swabs, which kind of have a bowl at the end to prevent you from poking down the canal too deeply. And those baby cotton swabs help get the wax out at the surface. You can also use your fingers when you're bathing the child, but you don't have to worry too much about wax. Wax is actually a good thing in the newborn period. Umbilical cord. So I think the thing to realize about the umbilical cord is that it's Mother Nature's scab. That's what I call it. It's how the baby protects their umbilicus as it's healing. And so we want to keep that area dry. I know in the past they've recommended alcohol and different swabs or maybe lotions. None of that is necessary. We want to keep the area dry. We want it to fall off when it's ready. Sometimes it may fall off a little bit too soon and it might ooze, and that's okay. If it oozes for more than 24 or 48 hours, we can see you in the office and we can put something on the oozy part to dry it out a little bit more quickly. But in general, there's really not a whole lot you need to do. I would just keep in mind when you're bathing the baby, you want to keep the umbilical cord dry with maybe a towel, and you just want to maybe sponge bathe the baby until that umbilical cord falls off and is dry. Circumcision. So in the nursery newborn period, your male baby, we recommend a circumcision. For the most part, you'll have a circumcision in the nursery. There are a few exceptions where it might be delayed. but a circumcision will be done either by the OBGYN team or the pediatric team. They're both very great at what they do. They both do a great job. As the circumcision is healing, it'll be very oozy, it'll look yellow, it'll look raw, it'll look red. It can look like that for a few days, and that's perfectly normal. That's the body healing itself. I usually like to put some Vaseline around the tip with some gauze and kind of sandwich it so it's not chafing against the diaper, but it will heal. Skin. So babies have all different types of skin. In general, I would say all baby skin have some degree of sensitivity. There's not a whole lot that you need to do with the newborn skin. I have no problems with any of the baby lotions over the counter, Aquaphor, Eucerin, all these products are fine. I think in terms of bathing, I'm a big believer of a good routine. And so I do like bathing babies every night, but you don't need to bathe rigorously. It's really just to get them into a bedtime routine. So you can put them into a baby bath and just for 2 seconds, kind of use your fingers to put some hypoallergenic wash on the baby and pat dry the baby to minimize some risk of eczema and rashes. But in general, baby skin does not need a whole lot. Okay. Next slide. So the next slide is called Should I Worry? And these are things that we frequently come across all the time in the pediatric office. We get a lot of these concerns. And so hopefully I will help allay your fears a little bit with these topics. So let's start with fever. So in general, a fever, what do we consider a fever? A fever is over 100.4 taken rectally. We see rectally because that is the most accurate way to get a sense of a baby's temperature. In general, less than 2 months of age, we consider a newborn fever an emergency, and that's only because we can't really assume where the fever is coming from. An older kid and adults, they can tell you what's wrong with them. Oh, I have a sore throat or my belly hurts. And they can give you an idea of where the fever is coming from. But in a baby, especially a young baby, less than 2 months of age, we don't really, obviously the baby can't tell us where the fever is coming from. And so sometimes we just need routine blood and urine tests just to help guide us in our decision making. So if your baby has a fever less than 2 months of age and you're checking it rectally, if the baby feels really hot or if the baby is really irritable, I would not panic, but I would call your pediatrician, and your pediatrician can guide you as in terms of what to do and what the next steps are. Hiccups. So hiccups, we're all familiar with hiccups. You will find that your baby will hiccup more than you're used to. Hiccups is just a normal reflex that we all have. It's just a mechanism of us swallowing air. It's normal. I think the thing to realize with hiccups is, we can, if something irritates us, we can kind of wiggle our nose or we can kind of scratch our throats. But for babies, they can't really do that. And so that kind of comes along with the next part, sneezing. This is just their normal way of clearing their throats and getting more comfortable. I think with hiccups, one thing that I recommend is, since it can be caused by swallowing a little bit of air pockets, when the baby's breastfeeding, if you hear the baby making noises when they're breastfeeding, I think I try to have the mom reposition the baby so they have a tighter seal so the baby's not swallowing air as they're breastfeeding. And then likewise with bottle feeding, I always say to leave a little bit in the bottle. And so that way they're not sucking all that air at the end of the bottle, and that might promote the hiccups. Also, in some babies with a lot of hiccups, burping more frequently might help. And so sneezing is similar. It's a normal reflex. It's a way that the babies can clear their nose, their throat. It's also a way that they can kind of deal with irritants or pollutants in the air. So perfumes, smoke, dirt, mucus. It's completely normal, and you will see your newborn sneezing more than you might think. And it's completely normal. It does not mean the baby has allergies or anything else. So periodic breathing, that's another topic. This is a type of very normal newborn breathing. I think, we're all familiar with our breathing pattern. It's very rhythmic, it's very calm, it's very normal. I think babies are trying to figure out how to breathe normally. And so it will be erratic. And so you might hear, instead of a deep breath in and out, like, you might hear more of like a, I don't know if you could hear that, but more like a, and that's called periodic breathing. And that's all normal. They're just trying to figure out how to breathe. I think you'll see them breathing like this frequently when they're sleeping. They will outgrow it. I think red flags would be if you see them breathing fast all the time and you don't get that slow breathing, then that's a cause for concern and maybe a time to call the pediatrician for advice. Eyes crossing. Again, the baby, just like periodic breathing, your baby's going to try to figure out how to breathe. Your baby's also trying to figure out how to see. And so they're opening their eyes and they're practicing and they're trying to see just like us, and they're using their eye muscles and their movements, and they don't know what to do. And so frequently you'll see their eyes crossing, and this is all normal baby behavior. They're learning how to use their eyes. You might see when they open up their eyes, they're very crossed, or they're looking in different directions. And this is okay. And you'll see that the first few weeks and even few months of life. Where it might become a little bit unusual is if you see one eye that's kind of crossed all the time, then sometimes we might evaluate that with an eye doctor and further care. Next slide. Okay, so now you are a pro at taking care of your baby. You know what to do. We want to see you and your baby and share in your progress and the baby's progress. And so let's talk about the well visits and vaccines. And so when are you going to expect to see us in the office with your baby? So we will typically do obviously a newborn visit. And that'll be like 1 to 3 days typically after your baby gets released from the hospital. We'll do a couple weight checks depending on how much weight loss there was. And that might be every few days. We might do a 2-week weight check. This is all variable depending on your baby. And then we'll do some preventative visits anywhere from usually at 1 month of age, 2 months of age, 4 months of age, 6 months of age, 9 months, and then 12 months and so forth. And some offices might vary in that, but that's just kind of like an average or an estimate for what to expect. At these well visits, we'll check the weight, we'll check the height, we'll check the head, we'll show you the growth curves. We'll obviously hold your baby and we'll go through your concerns, any issues that you may have come across. We will also give you a series of questionnaires. It might seem daunting. There's a lot of questions that we ask you to fill out for us, but this is all just to help care for your baby. Some of the questionnaires might ask how the mom is feeling. Some of the questions might ask how the baby is developing and progressing. We might ask about the baby's milestones. We might also ask about any environmental exposures, such as any concern for a lead risk or tuberculosis risk. And this is just to further guide our care and to do what's best for your baby. So you might see that we are asking a lot of questions, but this is all just to help best care for your baby. In terms of the vaccines, and now vaccines arguably are the most important things we do as pediatricians. We will have that discussion with you right at the newborn visit, typically. We typically recommend the hepatitis vaccine at birth, anywhere from 1 to 2 months of age, and at 9 months. So that is the first vaccine that you will come across. And then in general, I don't want to go too into the vaccines, but in general, at 2, 4, and 6 months in age, we do the same vaccines, a first time, a second time, and a third time to make sure your baby is fully protected. And so those vaccines in general are 2 shots and 1 liquid. We protect against things that are very important to protect against, such as baby pneumonias, whooping cough, tetanus, polio, meningitis, which is a very bad infection of the brain, and very severe stomach viruses, which babies used to get very dehydrated from. So these are the general vaccines that we all administer at Allied. Oh, and this is the slide that discussed exactly what I just said. So this is the 2, 4, and 6 month visit. These are the different vaccines that I discussed. I also should mention that at 6 months of age, we start talking about the flu vaccine, which is very important now that it's the fall and flu is coming. We will discuss that, but we cannot give, the flu shot is not recommended until we cannot give it until your baby is 6 months of age and older. And those are the different screens that your child will receive and the different things that we start discussing and start doing at the well visits.
I think that's me. So if you're pregnant and or just had your baby and you haven't chosen a pediatrician, how do you choose a pediatrician? Well, there's lots of different ways. One is ask friends, ask local people. You truly want to find a pediatrician that would be fairly local to your home or for your where you work if you're working outside the home. That is a key factor because you have to figure how often you're going to be at the pediatrician. Also, your child will get sick. It's just the nature, and you got to be able to get your child to the pediatrician. Later on, we'll talk about telehealth, which Allied has a great system for that. But you're going to have to, at some points, get to the pediatrician. So locality, convenience are going to be your first choice. Then you've gone, you've looked, you've checked your insurance for the pediatricians that are local to you. How do you then choose? You ask friends, you ask local people. When people move to a new area, I always say call the local hospital, call the nursery at the local hospital and ask who the nurses use. That's always a good recommendation. So you want to look at availability. You want to look at, or do you want a solo practitioner? Do you want a group practice? Do you want somebody who do you need weekend hours? Do you need late hours? Those are the things that are going to help you choose the right people. My one thing is everybody's going to go online and read reviews about doctors. It's like reading a review about a restaurant or a hotel. People tend to write good things and really bad things. There's never a lot of the in-between. So sure, go ahead and read the online reviews of the pediatrician, but remember, look at it like you think about a restaurant. You don't always believe what you're going to read. After you've gotten a list of pediatricians, you're going to want to say to interview them. I can honestly say the majority of our divisions will do some sort of meet the doctor visit. Here at Chester, we do them online. We're able to tour you around the office so you can see it without having you to come in. Should you choose to come in, we can arrange that so there are no other patients at that time. And many of the divisions do the same thing. We're all very happy to answer any and all your questions, especially if they're specific to you, your family, and your child. And you're going to make the best choice for you. Sometimes within a practice, there's multiple pediatricians and you've gone with one, met another, and and really for some particular reason hit it off with that one, nobody's really going to care. We want happy patients, we want happy parents, makes for happy pediatricians and happy children. Next slide. COVID-19 and your newborn. Well, this is a topic we are not getting rid of for a while, and it's a topic that we've been dealing with. Luckily, things have changed. We've got vaccines, we have better treatments, but as pediatricians, we do recommend that everybody around the patient, around the baby, get COVID vaccinated. That's the first way to protect your newborn. If mothers are vaccinated prior to pregnancy or during pregnancy, you're going to pass along those antibodies to your newborn, just like you pass along antibodies for all the other illnesses. It's going to help protect your newborn. We talked about breastfeeding. Breastfeeding, we know, will pass along great antibodies. Will also protect antibodies from mothers who have had the illness as well as the vaccine. I do recommend that everybody who's around the baby get vaccinated, just to protect the baby. What do we know? We know that most children do well with COVID. There are other cases where there are, problems. I've had babies as young as 3 days have a positive COVID. And luckily the children have done well, but it's very important to think about that. If somebody else is going to feed your baby who's not part of your immediate family, I do recommend that they wear a mask, just to be safe. Certainly in the middle of flu season, it's going to protect your baby from getting flu as well. So I'm a big proponent of COVID vaccines. As Dr. Fierstein knows, it's near and dear to my heart and my family. So it's important. I think anything we can do to protect a newborn is the thing we must do. Next slide. Self-care. We talk a lot about self-care from work, self-care, take care of yourself. I think the most important self-care is the self-care of a new mother. If you don't take care of yourself, you're not going to be able to take care of your baby. You need to take time. You need to be able to say, I need help. And that doesn't mean you're failing as a mother or a parent. You know what? We all need a break. If you have a partner, your partner needs to be jumping in and do as much as they can. We like to say, take all the help you can get. Order your food in, let your laundry pile up, sleep when you can, eat when you can, take that 12-minute shower. I mean, your baby will be fine. It's really important that you take time to take care of yourself. You just had a child, and you're going to be sleep deprived, and you're going to need that 2-hour nap in the middle of the day. Let somebody watch the baby for you. They'll wake you up if you're breastfeeding. These are important steps. Go out for that walk. It's a beautiful time right now. Go outside. Walk with the baby outside even. But take time for yourself. Take time. Let your partner, let your family do as much as they can. You need to recover from delivery. You need to rest. And every time a new mother leaves my practice, I always say, eat when you can, shower when you can, sleep when you can. It's really important. The happier you are, the happier your baby is. The more relaxed you are, the better you are to be able to take care of that infant. Next slide. So you've heard a bunch of us talk, and Allied is a group of 30 plus divisions of general pediatricians mainly. You heard Dr. Fierstein talk about it. But besides your office, what else? Allied is here. We work together. We spend time discussing all the quote unquote latest and greatest things, questionnaires, newest medicines, newest things that are coming along for us to help you. But the great thing that was mentioned before, we have a breastfeeding medicine division. Dr. Macaluso is terrific. And the nice thing is, she does a lot of telemed. She will see you whether you're out in Southold or up in Monroe or in Westchester. She sees our patients via telemed, and it's wonderful. So you have a breastfeeding medicine division completely devoted to helping you and your baby. And Dr. Macaluso talks about the 4th trimester, which is very important. And there's some great videos on that. Besides the breastfeeding medicine division, there's telehealth division. Well, each of our divisions will do some telehealth during their regular business hours. Allied has its own telemed division staffed by pediatricians from 6:30 to 10:30 every evening. It's a great asset. They can see everything that your child has in your child's chart because they have access to that. And the best part is, as pediatricians, we get to see what was done and not have to figure out what some urgent care did. So always remember that we do have telemed after hours. It's wonderful. What else? You heard about Dr. Fierstein's videos. We have a whole selection of videos. There's Dr. Fierstein and her grandson, and she talks about development and feeding. They're wonderful videos to learn. You get to see a really cute baby as well, but I think Dr. Fierstein is somewhat prejudiced on that one. But it's great to see it. And the way she explains it, it's wonderful. There are videos on all sorts of things. The baby basic videos, all the different talks, because as pediatricians, we're all a little different. We're all a little unique. So you can hear different things. There's webinars, on mental health. There's, you'll see different things on what to expect at each well visit. And these are great assets. So it's not just your home office, it's all the things behind the scenes as to help you raise your children and keep them healthy. That's really what Allied is all about. We do have something called the New Parent Helpline, which is usually during general business hours, and you can see on screen that you can text, you can call, somebody is there to answer your questions. And the nice thing is, if the person who's answering the phone doesn't have an immediate answer, she pops it into the entire Allied physicians chat, and one of us answers her to answer you. This is a group approach. It really does take a village to keep a healthy and happy child. So we're all there to support you, whether it's your chosen doctor at a chosen division or telemed or breastfeeding or parent helpline, we're here.
Okay, thank you, everybody. I love these because I love hearing how everybody approaches things and the little things that you learn to say to patients. And I always learn something, and I've been doing this a long time. So some things that came up that I think we need to clarify. So Dr. Lidoshore, one of the moms said that she got the Tdap during pregnancy. So does she have to give her baby the DTaP? And can she wait? Does she have to give it at 2 months when they're so little?
Okay, so yes, absolutely. The baby still needs to get their vaccines on time. They may be getting some of the immunity from you during the pregnancy. However, that immunity wanes over the first 6 months, and the babies need their own immunity to be built up. So yeah, it's important for them to get that 2-month vaccine.
Thank you. And Dr. Kasnicki, one of the questions was, when is it safe to see other children? Like, do I have to wait once they get those vaccines at 2 months, is it safe then to go out and see other people?
Yeah, so that's a question that comes up very frequently in the office. I think something to remember is, if you have your baby and it's your first child, that baby might not be around a lot of people the first few months of life. But if that is your 10th child and that child has 9 other siblings running around, that baby will be exposed to germs all the time, and that's okay. And so I think this might be an individual decision. I think what I normally say is be careful the first 2 months of life, because we try to avoid a fever, because that might mean unnecessary blood and urine that might need to be done for the baby. And so you want to try to be careful the first few months of life, especially when they're not vaccinated. But even when they get their 2-month set, that's only a partial immunity to the diseases. They're not fully vaccinated until several months later. And so I think you have to gradually introduce the baby with family and friends, and it's good for their development. So I think it's gradual and it's an individual decision.
Yeah, I agree. And I think with COVID, we've somehow gotten a little turned around when it comes to children. Children have to get sick. I mean, we don't want them sick under 2 months of age. And, really, we don't want them sick, but that's how they build their immunity, by getting sick. And I always tell patients, when you have your second child, you're not going to send your toddler to go live with the neighbors, right? So you kind of have to take everything with a little bit of a grain of salt. So Dr. Levene, speaking of sickness, how do I know if my baby is sick? Like, I'm worried that I'm going to miss something.
As you get to know, you're going to know your child. It'll take a few days, but you'll know the baby's signs. A lot of it is the baby's cold, the baby's feeling warm, and as was discussed before, you're going to take a temperature. One of the key signs that I always find is the baby's going to not eat as much. There's going to be a drop off, or not want to eat, or not want to eat as often. That's a huge sign that there may be a fever. Or maybe something wrong with the baby, or the baby's having a lot looser stools. Remember, newborn stools are going to be looser than adult stools, but they're going to be much more watery. Those are pretty good signs. The other thing is the baby's sleeping a lot more than it used to. The baby would wake up every 3 hours to eat, and the baby's been sleeping 6, 8, 10 hours. I mean, you think you're getting lucky, and hopefully you are, but you may want that first night to check that out, especially if the sleeping is more during the day.
Thank you. Dr. Kasnicki, spitting up, is that normal?
So we call spitting up reflux, and reflux is absolutely normal in babies, but it's a spectrum. Some babies will spit up more than others. In general, your baby will spit up frequently, and we typically don't worry if the baby is gaining weight well, the baby is thriving, and the baby is happy. The happy spitter upper is a baby that spits up and the milk dribbles down the side of the mouth. Typically, spit up will peak at 2 months of age, and then it will gradually get better on its own. And so it is completely normal, and we can help guide you to help make the baby comfortable during the spit up.
Thank you. Dr. Lidoshore, circumcision, is that something that you recommend?
That's a good question. So yes, for medical reasons, I do recommend it. I know there is definitely controversy around it, and in some cultures it's not accepted, and that's okay, as long as you are pulling back the foreskin and cleaning underneath as much as possible. But there is an increased risk of urinary tract infection without circumcision. And so for that reason, I typically would recommend it.
Dr. Levene, you're in the same place there?
I actually am not in the same place. It's as Dr. Lidoshore has said, there's lots of different issues. I'm on the philosophy of what do you want to do? What are you comfortable? Most fathers want their sons to look like them. It's just an easier explanation. So I'm supportive of whatever decision the parents want to make. Again, like was just said, it's a matter of cleaning. There is that increase in urinary tract infections, and there's some discussion on sexually transmitted diseases, which is a whole other discussion in many, many years down the road. But it's a decision that I will support either way, as long as the parents are comfortable. The hardest part is when the two parents disagree, and then I try not to weigh in at all.
Dr. Kasnicki, SIDS, the AAP came out with guidelines about using pacifiers and sleeping with mom in the room with the parents for a certain amount of time. Do you have any thoughts on that?
Yeah, so I mean, I think traditionally we always taught our families that the safest thing to do is to put them in a crib, sleeping on their backs, with no pillows or bedding or things on the side of the railings. But we know that there is a lot of co-sleeping that goes on. And so the AAP did the right thing a few years ago and modified their guidelines to say, okay, we know that a lot of parents like to sleep with their babies and their infants, and we're going to give you guidelines to let you do that in the safest way possible. And so again, I think this is an individual decision. Personally, I found it very difficult to get good night's sleep for myself when the infant was in bed with me. So I couldn't do that. My husband couldn't do that, but some parents really, really enjoy that. So if you are going to do that, there's ways to do that in a safe manner without any pillows. It's very important to not have the baby fall asleep on you. The baby could roll over, and you also want the bed to be large enough so that the baby is sleeping in a firm surface, and it minimizes the risk of you possibly rolling over onto the baby. So there's ways to do it in a safe manner, and I think that is an individual family decision.
So somebody asked about a Montessori bed, and Karen, I had to Google it. So I've never had that question, but Dr. Levene, do you want to talk about cribs versus beds and when you move your baby out of the bassinet?
Well, I can only talk from personal experience, and what I tell my patients is the bassinet by the bedside of parents in those first few weeks does make life much easier. It's just easier to lean over, grab the baby, give the baby to mom to breastfeed or formula feed. I had a whole arrangement, so I never had to leave the bed. Everything was right there. I don't even know what a Montessori bed is, so I can't wait to hear what it is. But there are the co-sleeper beds that line up right against the parent's bed. So you're sleeping with the parent, but not in the middle of the parents. I'm always terrified that somebody's going to roll over. If your bedroom is big enough and your baby is not eating every 2 hours, the crib in the bedroom, so you can be with the baby, is a wonderful thing. Also depends on your comfort level. For me, when the baby was only feeding once a night, that baby was in another room with a monitor. It was just, we slept better because we're not hearing every little noise. And that's what I recommend. But you know what? You have to go with how your comfort level, how you're going to sleep better. If you're going to sleep better with that baby in the room with you, preferably not in the same bed with you, then that's going to work best for you. I always like to say every home has its own rhythm and its And with each baby, it could be your second baby is not going to have the same rhythm as your first baby. So you need to figure that out. But what works with your friend's home or your sister's home or your brother's home may not and probably not will work in your home. You're going to find out what works well for you.
Yeah, I do want to reiterate the, not falling asleep with the baby in your bed or on you. There is a safe sleep organization. I don't remember the name, but it was started by a cardiologist, I think a pediatric cardiologist, who actually suffocated his baby when he, was post-call and fell asleep and didn't realize. The other two things that are key is not to take charge of your baby in that way with any alcohol or cigarettes. Those are two things that are both increase the risk for sudden infant death if the baby is around you and you fall asleep with them. Dr. Lidoshore, there's a question about burping. So how do you know if, sometimes you just try and the baby doesn't want to burp. Is that okay? Can I lay them down? Can I let them sleep?
So it's completely okay. If you've tried and the baby is not super uncomfortable, it's okay to let them lay down. It often will come out the other end and it won't end up being a problem for them. If it's a refluxy baby, so again, as Dr. Kasnicki said, there's a big range of reflux, normal spitting up, to babies that are really, really uncomfortable. Sometimes we'll tell you to hold them up a little bit longer, 30 to 45 minutes instead of just 10 minutes. And to try burping for a longer period of time. But as long as the baby's comfortable, it's okay to lay them down. Nothing is going to happen.
Dr. Levene, there was a question about COVID vaccine for the 6-month-old. Now, I know we've done webinars and people can go to the Allied site and look that up, but are you recommending the COVID vaccine for your 6-month-olds in your practice?
I am recommending the vaccine for 6 months and up. Just like any other of our vaccines, it protects our infants. And as much as you try to say, I'm not going to let anybody around, I'm not going to do anything, your child and yourself are going to be out in the community. And there is a lot of COVID out there. Omicron B5 is very contagious, much more contagious than any other variant we've seen. Thankfully, it has been more mild, but vaccine is the best way to immunize your children. As Dr. Fierstein just said, we did do a webinar a couple of months ago for vaccines for the 6-month and up. I encourage you all to watch it. It has some great information. I'm a little biased, but there are two different brands, both Moderna and Pfizer. Moderna being 2 shots 4 weeks apart, Pfizer being 3 shots, the first 2 3 weeks apart, the next one 2 months later. So you can choose either one. They're both as effective in protecting against COVID. Now, there may be a little confusion. The primary series on COVID vaccine for both the 6-month and up, as well as anybody else, the primary series will be of the original COVID. I like to call it OC. The new booster, which is the only booster that should be given, is what we call a bivalent booster. It has both the original COVID and the Omicron B5 in it. I took it the first few days it came out. I will tell you, my daughter was in the original Pfizer trial and was in the Omicron trial. So we're firm believers in this and we trust it completely.
Yeah, and the reason Dr. Levene says he's prejudiced is because his daughter, who is an epidemiologist, has been on all of the Allied COVID webinars. and she's amazing. And if you're looking for somebody to explain it to you in a really easy to understand manner, you really should check out the Allied webinars. Dr. Kasnicki, I think we have 2 more questions. So we'll start with, how often do I have to feed my baby during the night?
Yeah, so that's a great question. I think obviously that depends on how old your baby is. So in the newborn period, when the baby has lost some weight, we want to see them be able to regain that weight. It's much easier to feed the baby once they're at birth weight. So they almost have to do double the amount of work in the newborn period, because they have to make up for the lost weight, and then they have to eat to gain. So typically when I see them in the newborn period, I say anywhere from 2 to 3 hours. 2 hours during the day, every 3 hours at night. Some babies will do more on-demand feeding. And then once the baby has shown us and has proven to us that they know how to eat, they know when they're hungry, they know how to gain, then you could spread that out more in the night period. So I think that will depend on the initial, the rise of weight gain in the beginning. And then we can guide you from there. I also am very mindful of not messing up with a sleeping baby's pattern. So if a baby wants to sleep and the baby's past birth weight, let that baby sleep. And so that time frame will differ for most babies. But I will tell you, my first and my other 2 slept terribly, but my first at a month of age slept 12 hours a night and was thriving and gaining weight, and I did not mess with that baby.
My first grandson as well, and my daughter's a little bit nervous about what's to come.
Yeah.
But these are all great questions, and we're giving general answers, but these are questions that you can and should be asking your pediatrician. You know, write them down, come in with a list. You know, we laugh when new moms come in with a list, but we're happy to go through all of them. We get them all the time. There are no silly questions, and we want you to have. I'm looking at the pop-up as it comes up. We want you to have that information, and it makes it easier for you. It makes it easier for us. As far as tummy time, which was the last question I just saw, you're going to put the baby on, they're going to stay for a little while, then they're going to start to cry, and you're going to pick them up, right? There is no exact time where we say, oh my God, you have to do this for X amount of time and that for X amount of time, whether it's sleeping at night. Like Dr. Levene says, there's a rhythm with that baby. And some of our answers here may fit your baby perfectly, some may not, and you're going to need to talk with your pediatrician about that. Dr. Lidoshore, any closing comments?
So I think you said it. I mean, there's no stupid questions. We are there to support you, whatever your decisions are with your baby. And any question that you have, please give us a call, make an appointment. Again, the lactation consultants and specialists are there. We will do our best to get you through the most difficult period, those first few weeks.
Yeah, and our newborn parent hotline, the person that answers the phone there is lovely, and she will help you find the right allied practice for you by giving you that information. And even if you end up not going with an allied practice, she is available to you for some basic questions. Obviously, it's hard to give answers when we don't have all the information, but we are there to try and help you. Dr. Kasnicki, your closing words.
So I just want to say that there's really no one size fits all. I think every baby is different. Every baby is unique and special. And we look forward to meeting them and guiding you guys during this very exciting, sometimes stressful time, but everybody will get through it.
Agreed. The one pitch I want to make for one size fits all is vaccines. You have to vaccinate your babies, and you need to do it on the AAP schedule. We didn't really talk about different schedules and other ways to go, but just trust us that this has all been researched and studied. And when you go off the board and create your own schedules, you're really looking for trouble because you don't know what's happening, and a delayed vaccine. One of the reasons New York State is now in a state of disaster around polio, that is the official proclamation, is because vaccine rates have not gone back to pre-pandemic levels. And it is key that you vaccinate your baby according to the schedule that your pediatrician gives you. Dr. Levene, closing words?
Just take time to enjoy that baby. We talked about feeding and problems, and just really take time every day and just be amazed at your child. And that is just the warmest feeling you can have.
Yeah, everybody says it goes so quickly and you don't believe it when you haven't slept for 3 days, but it really does when you look back. So thank you all. It's really been such a pleasure talking with you tonight. And thank you to the audience for such great questions. We are going to send out a copy of this presentation for anybody who signed on late, in addition to all the links of the things that we were talking about. And we're going to all hang up and probably go look and see what a Montessori bed is. But other than that, so we always learn from our patients as well, right? Have a great night. Have a great time with your baby. And like Dr. Levene says, enjoy. Good night, everyone.